One of the hottest topics in hip implant litigation over the past 6 or 7 years has been device failure due to a term called metallosis. Metallosis really is sort of a fancy word for a problem that occurs in and around the hip joint, adjacent to the hip implant, when the device gives off metal wear. The device gives metal wear off, it gets in the tissues react, it causes significant inflammation, sometimes it can cause the growth of aberrant tissue, and as a result of that, the patient gets very painful. Metal ions can circulate in the bloodstream, and ultimately the hip generally should come out. There have been probably 5 hip implants over that course of time that have been implicated in causing metal wear disease. The vast majority of those really were a product or products that involved a metal bearing surface, which means a one-piece metal cup and then a one big giant metal head. And when it's implanted in the human body, this goes in the acetabulum or the hip bone. This is on the end of a femoral stem that goes down in the femur, and it forms a hip socket to replace the arthritic hip socket of the patient. Many of these devices were implicated because the bearing surface, when it rubs together, there's insufficient lubrication between the two surfaces, and when you have metal rubbing on metal, you're going to get metal debris. Some of the devices had problems with the design of the cup so that this ball could kind of ride on the rim of the cup, all causing similar problems. More recently, though, what we are starting to see, and the literature is starting to recognize, and the scientists are starting to study, is a very similar result, but from a completely different issue. And that is when you take a one-piece metal stem and you put a large metal head on that stem, even if you have a plastic socket for that ball to go into, we're starting to see metal wear disease caused by corrosion products that occur where the trunnion, that's this part of the femoral stem that inserts into the femoral head, the trunnion, where the trunnion meets the female taper of this metal head, you're seeing almost exactly the same problem that we saw in some of the dual modular designs, and that is motion of the femoral head, very small motion, it's called micromotion, which breaks down the passivation layer, which is the protection between these two metal surfaces, and then, to use a layman's term, it rusts or corrodes. And when it rusts or corrodes, it gives off metal wear debris, it gives off metal ions, that gets in the tissue around the hip, it becomes inflamed and has all the problems that I mentioned earlier. This is a new problem, at least as being recognized by the medical community. If you go back in the medical literature, all the way back to the 80s, there's a lot of scientific study about trunnion wear and metal wear disease being caused by trunnion wear. But then things just kind of go dark for about 20 years and not much is written about it. What is the thought process of the smart people in the scientific community and some of the doctors that are studying this problem is, over this same period of time, manufacturers started making bigger and bigger and bigger metal heads. As you can see, there's a significant difference between the size of those two metal heads. In the old days, most heads were 32 millimeters or smaller. And then in more modern times, because the companies were marketing these larger, up to giant heads as being preventative of hip dislocations because of the larger surface area, doctors went bigger and bigger and bigger with the thought that they could possibly prevent the risk of a hip dislocation. Well, the problem is with these giant heads on that stem, it's much more torque on this interface between the stem and the head. As a result, there's more motion and you can get significant corrosion. When you talk to doctors these days, they're doing one of two things. They're going back to much smaller metal heads, or doctors have abandoned the use of metal heads and they're going to the use of a ceramic head, which fits on there, and there's absolutely no interplay between the two metals of the devices. This is basically sand, silica, or ceramic, on top of the metal head, and then they're using a plastic cup. If you get a hip implant in 2016, 17, 18, you're more than likely going to see the doctor, unless there's some insurance issue or money issue involved, you're likely going to see the doctor put in a one-piece titanium stem, a ceramic head, a plastic cup, and then there is a metal liner, essentially, that goes behind this snaps into. For my dollar, if I had to have a hip implant today, that's exactly the construct that I would ask the doctor to put in me. That keeps metal from touching metal across the whole construct, from the femur all the way to the acetabulum. Of course, there's risk with any construct, but that significantly reduces and or completely eliminates the risk of having a metal wear disease failure. Given the fact that every manufacturer across the board has been accused of having a construct that caused metal wear disease from the early 2000s until 2012, 13, 14. This by far would be the safest construct to go with. We currently are representing probably 100 to 200 people who have had failures of metal stems, titanium metal stems, with chrome cobalt heads, for the exact same reasons we represented all the people back when we had bearing surface problems and dual modulars. Same exact result, different cause.